California task force to study and develop reparation proposals for African Americans. Content warning. It contains discussions of racial discrimination, sexual assault, torture, lynching, and other forms of extreme violence. Contains unedited historical quotations and photographs of white supremacist hatred, torture, lynching, autopsy, and other forms of graphic violence.
Mental and Physical Harm and Neglect Chapter 12. Introduction. Scholars have stated that Europeans developed a racial hierarchy in which black people were relegated to the bottom of humanity and often placed outside of it altogether. In order to justify the enslavement of African people, the United States is no exception to this global reality. This chapter will describe how federal, state, and local governments subjected enslaved people and their descendants to brutal and dehumanizing conditions, policies, and practices. The United States has treated African Americans as subhuman and engaged in practices harmful to the health of African Americans through forced labor, racial terror, oppression, torture, sexual violence, abusive medical experimentation, discrimination, harmful neglect, and more. As will be explained throughout this chapter, scholars have stated that racism and enslavement are, at least in part, responsible for the fact that African Americans have had the worst health care, health status, and health outcomes of any racial or ethnic group in the United States. During enslavement, enslaved people were treated like animals, and physicians provided health care only to the extent necessary to profit from enslaved people's bodies. After the end of slavery in 1865 and a short-lived period of Reconstruction, federal, state, and local government officials worked with private citizens to segregate African American communities, damaging black health, creating unequal healthcare services for black people, depriving African American communities of safe sanitation and adequate sewage systems, and sacrificing black health for medical experiments. During the 20th century, federal and state-sponsored corporatization of healthcare resulted in rising healthcare costs, the separation of black doctors from black patients, and further inequality between white and African Americans. Centuries of exposure to racism has contributed to a serious decline in African American physical and mental health. African Americans die at disproportionately higher rates from preventable health problems. Doctors are more likely to misdiagnose African Americans, leading to disparate outcomes in mental health. African American women face high rates of maternal death and adverse birth outcomes. Even black women with the highest education attainment have the worst birth outcomes across all women in America. African American children face poverty, malnutrition, and worse health than that of white American children. 10. The mismanagement of public health crises by county, state, and federal governments has resulted in an undue burden of disease and death in African American communities, particularly during the COVID-19 pandemic. 11. Despite this, in the face of overwhelming oppression, African American healthcare providers, patients, and community members, nonetheless, have worked to build healthy communities and fight for a more equitable healthcare system. 12. Section 3 of this chapter discusses the racist theories developed and perpetuated by doctors and scientists about African Americans. Section IV describes the health conditions of African Americans during enslavement. Sections V, and 7 discuss how systemic discrimination and segregation was established and how it continues in the American health care system. Sections 8 and X describe the history of medical Experimentation on black bodies throughout American history, and how medical research and technologies harm African Americans. Section X describes the history of racism in mental health and the effects of 400 years of racial oppression on the mental health of African Americans. Sections 11 and 12 discuss reproductive, gender identity responsive healthcare, and child health. Section 13 discusses public health crises. Section 14 describes the effects of racial oppression on the physical health of African Americans. Today, studies have found that a significant number of white medical students and residents hold false beliefs about biological differences between African Americans and white Americans, such as the belief that African Americans have a higher pain threshold than white Americans. 2. Pseudoscientific racism as foundation of healthcare. During the enslavement era, scientific racism defined race as an innate biological and genetic trait. 13 pseudoscientific definitions of blackness were based on differences in skin color, facial features, hair texture, lip size, and false beliefs about brain size and immunity to diseases. 14 pseudoscientists invented phrenology, the baseless science of measuring the size of the skull as evidence of intelligence in different races. 15 This pseudoscience was influential across the United States throughout the 1800s. 16 During the slavery era, medical researchers tried to prove that black people were biologically suited to slavery. 17 In the 1880s and 1890s, the decades following Reconstruction, false medical theories explained the poverty that African Americans experienced as justified by their inherent inferiority, instead of as the result of almost 3 centuries of enslavement. 18 doctors published influential studies stating that African Americans' immorality was responsible for the syphilis and tuberculosis they suffered. 19 In 1880, the New Orleans Public Health Agency claimed that African Americans' naturally weaker immune system and irregular habits were the reason that so many African Americans died, rather than inadequate access to sanitation, drinking water, food, and overcrowded uninhabitable housing due to racial segregation. 20 During congressional debates over the establishment of the Freedmen's Bureau, a program which included government-funded health care for newly freed Americans, white legislators argued that health care assistance to free black people would result in dependence. 21 Consequently, federal and state governments relied on racist theories to justify slavery and racist neglect in public policy. 22 In the 20th century, the federal and state governments supported the eugenics movement, which sought to eliminate non-white populations considered to have undesirable traits. 23 Eugenics is based upon the white supremacist ideology that white Anglo-Saxon people are an inherently superior race. 24 Eugenicists enacted laws resulting in the forced sterilization of undesirable races, including black people, to create and maintain a white supremacist nation. 25 By 1931, 30 states had eugenics laws that targeted vulnerable groups across the nation for involuntary sterilization in federally funded programs. 26 It was not until 1979 that federal sterilization regulations required voluntary consent of the person being sterilized. 27 Today, studies have found that a significant number of white medical students and residents hold false beliefs about biological differences between African Americans and white Americans, such as the belief that African Americans have a higher pain threshold than white Americans. 28 Black patients are especially vulnerable to harmful biases and stereotypes, including the undertreatment of their pain. 29 Physicians widely hold racist beliefs that African Americans feel less pain or exaggerate their pain. 30 These beliefs result in racial bias in pain perception and treatment. 31 Consequently, anti-black pseudo-scientific racism that justified enslavement continues to adversely affect black health today, as a vestige of enslavement. Despite centuries of pseudoscientific racism and anti-blackness in the healthcare system, black doctors, nurses, And healthcare workers have worked tirelessly to provide anti-racist culturally responsive healthcare to Black communities. 32. California. California civic leaders were some of the most influential proponents of eugenics in the nation and around the world, including in Nazi Germany. 33. They played a key role in popularizing the eugenics movement. 34. The Human Betterment Foundation was a private think tank based in Pasadena, California, that promoted sterilization from 1926 to 1943. 35. The Human Betterment Foundation shaped public policy in California by working with state officials, representing the eugenics movement to the public, and collecting data on sterilizations nationwide. 36. The foundation hoped that public support would result in state legislation that would increase the number of sterilizations performed each year. 37. The foundation's members included many prominent leaders of Californian institutions such as David Starr Jordan, Stanford University's first president, Los Angeles Times publisher Harry Chandler, Nobel Prize-winning physicist and head of the California Institute of Technology, Robert A. Millikan, and University of Southern California President Rufus B. von Kleinsmith. 38. Thousands of mental health patients were forcibly sterilized across California due to the eugenicist efforts of the Human Betterment Foundation. 39. Black patients were more likely to be sterilized than white patients. 40. Paul Popenoy, a self-trained biologist hired by the Human Betterment Foundation, stated that this was not surprising because studies show that the rate of mental disease among Negroes is high. 41. Hundreds of thousands of studies, pamphlets, and books written by the Human Betterment Foundation were distributed to policymakers, schools, and libraries. 42. In 1937, one of Nazi Germany's leading eugenicists wrote to Ezra S. Gosney, the financier who started the Human Betterment Foundation, saying, "You were so kind to send new information about the sterilization particulars in California. These practical experiences are also very valuable for us in Germany. For this I thank you." 43.